Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buhl. Techniques we discuss here are meant for licensed wildlife professionals. If you aren't licensed and trained for wildlife rehabilitation, do not attempt to capture, hold, or rehabilitate any wild animal. If you find an injured wild animal, a wildlife professional can recommend next steps. We will tackle topics about rescue, care, management, reconditioning, and releasing wildlife found in North America. This is a deep dive into each subject. We hope to give rehabilitators information they can use because they're already going to great lengths to rescue and nurse animals back to health. There are three possible outcomes in wildlife rehabilitation: release, euthanasia, and placement. An injured or orphaned wild animal's journey to restored health and independence in their natural habitat is delicate and complex. We draw techniques and expertise from many disciplines. Many animals brought into rehabilitation cannot be saved. The last gift we can give them is humane euthanasia. We'll talk more about when this is necessary. Sometimes animals are deemed non-releasable and evaluated to be suitable for a life in captivity. When that happens, we shift to a long-term approach to managing their care, training, and housing. Some such animals serve as ambassador animals, a term for animals that rehabilitators use to educate the public. Each episode, we'll speak with experts who represent specialty topics across the profession of wildlife rehabilitation, ambassador animal care and management, showcasing best practices. Hello, everyone. Welcome back. For the next two episodes, I'll be talking with wildlife veterinarian Miranda Torkelson. Well, Dr. Miranda Torkelson, I am so excited that you are here with me today because we are going to be talking about fox. Oh my gosh. I'm very excited about that. But before we really get into the rehabilitation and medical management, or maybe the reverse, medical management and rehabilitation of fox, specifically red fox, I think we're going to talk about. I would like everyone to hear your origin story. You and I have known each other for a little while, but everybody should hear this. So,
Well, thank you, Gail, so much for having me on your podcast. I'm super excited to talk about one of my favorite species, being the red fox. But a little bit about me, some things that you may not know even that I like to bring up in regards to wildlife. I grew up always being in the outdoors. That was my family's idea of a good time, was going to national parks. So that was instilled very early on, a love of nature, wildlife, being outside. And I've always loved animals. That's who I connected to as a child, kind of as I grew up. And so that connection into wildlife I kept coming back to it as I grew up, as I became an adult. But my first real connection hands-on with wildlife was actually in high school, my senior year. There was a project with the Wisconsin DNR where every 2 weeks during my senior year, I was able to go to a wildlife area and help with a ecology project on porcupines. And so,
what?
Yes.
Wait, what?
Yes. I swear,
people who listen do not know how much I absolutely adore porcupines. Oh my gosh.
We can go to porcupines another day. They're also another favorite. But I swear this staved off my senioritis in high school because we started going up the night before and just hanging out at this research site and then going around doing radio telemetry on porcupines, catching and monitoring porcupets and seeing how they grew and their measurements as they aged and all of these things. And so, understandably so, with an animal so cool as a porcupine, this really sparked my interest in the direct care of wildlife, being hands-on, learning from them, learning enough from them to teach people and to spread that respect, that understanding of different species we live with. So kind of all started with that porcupine, but spread into other animals as I went through my schooling. So I had some time that I spent in Hawaii working with coral and sea turtles. I did some radio telemetry on red-tailed hawks. And where foxes start to come in, though, it's actually in vet school. So that's where their story will come in, and we'll get into why they're my favorite. But that's kind of when they came into my wildlife life. But as I went through school, I got a degree in zoology from the wonderful University of Wisconsin, stayed there for vet school. And then as I completed my vet education, I ended up moving out to Massachusetts for a year. So that's where I did a small animal rotating internship, which in the vet world is kind of one of the ways you learn how to doctor before you decide where in that you want to go.
Yep.
There's a lot of rotating through different specialty practices, emergency medicine, internal medicine, and really getting a good idea of how to function in that role in a training environment. And then after that is when I met you, because then I did an internship with Partners for Wildlife. And so that was split between the Raptor Center and the Wildlife Rehab Center in Minnesota. By that time, I had really realized I wanted to do clinical care of wildlife. And so that was the perfect way to get a really in-depth understanding of wildlife rehab, how a vet can function in that environment, and then kind of what the scales are in wildlife rehabilitation. So from interacting with home rehabilitators all the way up to, high volume care, such as the Wildlife Rehab Center.
Right.
I got a huge overview of what the field is, built a lot of really great connections, and then after that stayed at the Wildlife Rehab Center as a staff vet for 3 years. So that's kind of how I got into the wildlife sphere, in my professional origin story. Kind of right now, I'm exploring how I use my skills, where I want to go next, and what part of our field I really want to plug into to benefit the growth of wildlife rehab.
Man, just your origin story with, I've done my degrees in biology. I've done a lot of field work too. I didn't get started in high school. So, man, I would have just been all over that if I had had that opportunity. So, man, more power to you that you took advantage of that and you went for that. But I do have a question. So you went and you got your bachelor's degree, but you went to vet school. So after that, so what was the thing? Because you could have gone into research, you could have gotten a PhD in, ecology or whatever, or ornithology or porcupetology. I don't know what that's called.
Oh my
Maybe
gosh,
mammalogy.
if that were a field. That's what I'm going to do next.
See, there you go. See, I'll help you out with that. But
Perfect.
what was the thing that was it? And maybe it wasn't one thing. Maybe there kind of was a through thread through everything that you were always interested in medicine, because we know the connections with wildlife. So how did the medicine part kind of come in?
Yeah, definitely. So I am one of those somewhat stereotypical in the vet med fields, people who knew at the age of 5 that I wanted to be a vet.
Okay.
I actually had it written down on like a kindergarten project in my big bold lettering that I want to be a vet when I grow up. And so I think that started with what a lot of kids do. They love animals, and that is the career that in our kind of socialization of children, it's a doctor, it's a vet, it's these basic jobs. And so it kind of started there because I loved animals and made sense. But as I kind of grew up, I actually, thankfully, one of my friends started shadowing at a vet, and my parents were always trying to get us into actually experiencing different things. So I started shadowing a vet in 7th grade, just so that I actually early on understood what that looked like. And I loved it. It was not what I expected. I remember thinking that. I remember kind of being surprised by what the job actually was, but falling in love with it more. So I really like solving problems and thinking through, the specifics of cases and trying to figure out why something is the way it is. I've always been that way. And in medicine, I was able to kind of take that interest, that learning, that problem solving, and apply it to actually, helping animals, helping lives, saving lives. So I've always been more of a caretaker, very
Mm-hmm.
invested in the people and the animals around me. And so I saw that as a way to apply that skill set, that personality trait of mine, to something that was beneficial to others
Right.
and also super rewarding.
Oh, man, thank you. Thank you for that. Because I really do think that it's important for people who are getting into the field, especially in wildlife rehabilitation or thinking about vet school or those kinds of things, to kind of have an idea that it's always, almost always, a crooked path, right?
So much so. And I know it doesn't sound like it from what I just said, because I said I knew I wanted to be a vet at age 5. It
Mm-hmm.
sounds very direct. And even with that knowledge and kind of that self-awareness of what my strengths were, it has not been a straight path
Mm-hmm.
because I've explored things along the way. I've explored, small animal medicine or different specialties. I love anesthesia and surgery. There are other things
Mm-hmm.
I'm interested in within medicine. And I've circled around the country or to different jobs. And so I think something I fell into, a lot of my colleagues and friends fall into when you have such a direct idea of where you might want to go,
Mm-hmm.
um, is only seeing that and
Mm-hmm.
missing a lot of the benefit of saying yes to things along the way. And I think some of the best experiences I've had are because I followed some little side trails along the way. I
Mm-hmm.
asked people questions. I had an interest in something and just went to that person and said, "Hey, like, can I work with you? Do you have an opportunity?" Asking questions like that is how I ended up spending time, 7 years actually, working in the zoology museum at the University of Wisconsin, as
Oh,
a,
now
a
that's
job.
interesting.
Yeah,
Wow.
as a job through my undergrad. I worked in the prep room of the zoology museum, and so that was a way for me to really get hands-on learning anatomy of every
Mm-hmm.
wildlife species in Wisconsin, as well as all of the zoo animals that ended up dying within Wisconsin, also
Right.
filtered through there. So that was because I heard they existed and walked in and said, "Hey, do you have any volunteer opportunities?" And then I worked preparing wolf skeletons for an entire semester, which
Wow.
got me other jobs and other connections. And
Right.
so finding the things along the way that just call to you, even if you're
Mm-hmm.
not exactly sure where it's going to go, but you're interested in it, don't be afraid to follow that, to take a little sidestep, to take a little more time to get where you might want to go, because you're going to have so much more depth of experience, understanding of where you're going, and really, like, if you take a little more time to get there, but you want to get there in the end, and you've
Mm-hmm.
tested that along the way, you will be the right person to get there. And if you find something else, great, because if
Right.
you don't explore, you won't find all those adjacent side jobs that are associated with being a vet, or
Mm-hmm.
being a biologist or being a rehabber. There are so many ways to work with animals that a lot of people are unaware of.
I'm fully on board with that. I totally agree when I talk to people about, well, how did you get to your job that you're doing now, Gail, or something? I'm like, well, because I was always listening and looking for opportunities. And if I was interested in something, I paid attention to it. And I've had a lot of fun adventures too. And all of those experiences that you've had, and that I've had lead to a richer you in your profession or what you're doing right now. The other thing I always oftentimes tell people, because I've managed a lot of volunteer programs too, and have been a volunteer for many, many years, is that it is to me that exploratory stuff that you were talking about is not just important to show you what you want to do, but I think it's even more important that you figure out what you don't want to do. So,
Yes.
for example, volunteering at the Raptor Center at the University of Minnesota, you might be gutting rats and prepping food. And you're like, okay, I really like raptors, and I really am interested in raptors, but not so thrilled about gutting the rats. Well, there's a lot of different things you can do with raptors. And if you had, just like you said, that you got surprises along the way when you were exploring what it was like to be a vet. Oh, this is not exactly what I was thinking it was going to be. I think that is one area. It's like, okay, well, I like raptors, but maybe I want to go study them in the wild. Or maybe I want to do something else, but I want to be a falconer. Or maybe I want to contribute to conservation programs for raptors, whatever. Or maybe I like to teach about them. So, those kinds of things. So I totally on board with trying to put yourself out there. And if you can, take those opportunities when they present themselves. I think it's an excellent, excellent way. And talk about enriching your own life and enriching and informing what you're doing now.
Exactly.
It's amazing.
And I think, a lesson I've learned, again, having such a initially directed path towards veterinary medicine, is there are times where you need to, make sacrifices of your current experience to achieve a goal or to get to a place in your life. But there's a balance there. And so also having the openness to being able to explore and to take time to do other things along the way, or take other jobs that seem intriguing, or whatever it is, to have more of that winding path is also super important, because this is our lives that we're using, and a lot of times we donate our lives to some degree to our profession, to the job we end up in that we care a lot about. But making sure that we stay in the moment as we go through our life and learn all of the lessons along the way, I think is something that, looking back on, we can always wish we learned things earlier. I don't regret what I did, but it's certainly a lesson that I have kind of illustrated in my recent life, and I'm really holding on to.
Right. No, I think it's wonderful, and a lot of wonderful nuggets for people to think about, as far as taking those opportunities, being open to them, being willing to kind of step out of your comfort zone a little bit, right? I mean, to go in and say, hey, do you have any volunteer opportunities? And probably, there might have been some thoughts about, do I really want to prep a wolf? And maybe it was, for me, it would have been, oh, heck yeah. But
yeah, that was the answer.
right. Because it's like, I'm the one who finds, carcasses or skeletons in the woods. And I'm like, well, can I bring this home? Or I'm always picking up things and looking at them. And I've been that way since I was a kid. So I think, man, that's amazing. So thank you for sharing all that. So then how do foxes come into this?
Yes. So foxes come into my life in two main times. So they have been important twice in my life, and I listen when things show up more than once. So the first time I really encountered foxes was during my vet school career. And so at the University of Wisconsin, there is something known as the Urban Canid Project. And so what this is, it is
I just heard a lecture from
Dr. David Drake.
Thank you. And it was an amazing talk on this study. So I'm sorry, yes. I didn't mean to interrupt, but I'm like, oh, I heard this. So
no, Dr. Drake gets that reaction a lot. He is a wonderful human, but he is the principal investigator on this study, looking at kind of the habitat use, behavior, and then kind of my little side project on it, the health of urban foxes and coyotes. And so with this project, they are was radio collaring, moving into GPS and cell, yay technology, red foxes and coyotes in the Madison urban area, and then monitoring where they are going, what habitats they use. Part of the project looked at how coyotes and foxes, how their ranges interacted with each other, and how those species potentially interacted within the urban environment. And so that project was going on at the University of Wisconsin. And as a vet student, one of my colleagues was an undergrad before vet school and worked with David Drake starting this project.
Mm-hmm.
So her
Wow.
and I then started some health monitoring of these urban foxes and coyotes. So trying to take advantage of the fact that these wild animals were captured for this research project to collar them. At that point of capture, we collected blood samples in order to test their serology for different diseases, test for heartworm disease, Lyme disease, leptospirosis, things like that, in order to try to characterize their health status in this urban environment. And so as part of that project, I both did kind of volunteered whenever they caught an animal to be on call to go collect blood, collect different samples, and arrange for other vet students to also get on this call schedule so everyone could get an opportunity to interact with these animals. But then I also volunteered on their telemetry project. So I spent, nights and weekends and other times driving around Madison, doing radio telemetry. So following around these foxes and coyotes. Our shifts were about 5 hours long because we wanted to get a sense of where they were going in different times.
Okay.
And so I spent quite a bit of time alone in my car, listening to radio frequency beeping, following foxes around, and just, I don't know, I found it to be such a unique experience. One, to see the city at different times in kind of the perspective of this animal, because I was trying to figure out where it was going, what kind of habitats it was using. I got very familiar with their territory, what neighborhoods they frequented, what times of day they were out. And it really gave me a little snippet into their life that I found really valuable and fascinating. So, I would be driving around a neighborhood and there was clearly a party in one house, and I saw him just dart right through the neighbor's yard, right next to all of this human commotion, like just kind of looked both ways and just shot through. And I was like, these people have no idea that this animal is living right next to them, is going about its life. And just to see how they adapted to this urban environment was fascinating. And we can get more into that and foxes in the city later if we want. But that was kind of my first glimpse of this very adaptable animal. And then kind of the second time foxes came into my life was actually in 2020. So start of COVID, I was working at the Wildlife Rehab Center at that point, and we get a lot of mange foxes that come through that center. They see everything but raptors. So in this area, right, a lot of mammals, birds going there. And so in that experience working there, I started to get really frustrated because it seemed like mange foxes would come in and they would start to respond okay to treatment or not. But I couldn't predict the ones that would live and the ones that I would find dead in the morning. Okay. And so as a veterinarian, I want answers. I want to understand. I don't like things dying not in my control, right? Like euthanasia is a gift I can give. If I miss it, then I feel like I missed something I could have helped with. Sure. And so I got so frustrated that I couldn't figure out how to predict that I took a deep dive into the care of mange foxes. And so I brought up at the start, this was 2020, right in the heat of COVID. And so in kind of the backdrop of the fear over health in humans, this global pandemic, a lot of feelings of there not being any sort of control in our lives, right? Right. There was this problem, and I was like, this is one I might be able to solve. This is a way I can have an impact. And so kind of woven through there as well, I was having my own health problems that a lot of the symptoms were similar. There were some nutritional things as well. And so this was also a very interesting combination of facing my own health and well-being and what I knew to treat an animal and how I could get insights into treating that animal, and then trying to reapply that back to myself.
Mm-hmm.
And so there was a very kind of deeper personal connection and this deep drive to really give back when a lot of things felt out of control. And so that turned into really diving into some background research. Any of these foxes who did have mange who died in care, I did full necropsies. I pored over them, looking for what we could have done differently, what we didn't find, and then each time changed the protocol to match what I found in those cases, to try to really learn from the animals that may not have made it, but I could use them to make an impact. And so through that whole process, that led to the creation of some pretty intensive care protocols for these animals that changed the kind of way they get care, the treatment they get, and turned those cases from this frustrating, they live, they die, hopefully you get the one that's living sort of feeling, to I know what can happen. This is the time span it might happen. This is what I'm looking for. This is how I intervene. And if they didn't survive, usually I knew why. And it was because something was too far progressed, not because I didn't know it was happening. So that was a really powerful thing, both for the sake of animal care and then animal welfare, and then kind of my own life story through that.
Right. Wow. And we're going to get into some of that and some of those cases and what they taught you and those intense protocols and things like that. But first, I want to talk about, so one of the things I noticed is that you didn't say, oh, I love red foxes because they're red, or they have a cute face, or I love how they pounce in the snow, or
oh my goodness, they're so pretty though.
They are very pretty animals.
I know. So I have to just, a little bit of me is like, so I love them, and I love them because of who they are as a species. And I love that people love foxes because they're cool animals. And of course, I love that the animal I love, other people appreciate too. But boy, I had to pick a really hot animal to like. Everyone likes foxes. They're so charismatic.
They are charismatic and they are beautiful. Boy, our red fox is beautiful. And all the fox species are actually very nice looking. Yeah, they're all beautiful and they all have wonderful, characteristics and things that, of course, you want to latch onto. So yeah, and
they can't help, they're so pretty.
They can't help, they're so pretty, and in fact, they're so pretty that when people find the podcast, this podcast, the graphic identity for the podcast is a red fox. I wonder why.
I wonder. It's a good choice.
Why. It was a good choice. I think it was a really good choice. So I thought that we would take the next piece and talk about natural history of red foxes. And you've had experience with red foxes, not just here in Minnesota. So that's going to give a little bit more depth because, natural history, changes a little bit depending on where you are, where your habitat is and where you're located and if you're urban or not, or that kind of thing. And one of the reasons that I do this is because I feel that natural history is what you need to go back to all the time to inform your rehabilitation. And so I find it, and part of this, of course, is I do have a biology degree, so I'm really interested in natural history of everything. But I think as rehabilitators, we need to really, and veterinarians, we really need to look at natural history. So natural history of red fox.
Yes.
Have at it.
All right. Well, did you know that they are the most widespread terrestrial mammal in the entire world besides humans?
I did not know that. I would have assumed it would have been a rodent, because rodents are very successful, like rats or mice or something like that. But really?
Red foxes. Yep. They are on every continent except South America and Antarctica.
Wow. Okay, you just blew my mind already. I love it.
There you go.
I love
it. There are at least 45 subspecies of red fox, but we all have experienced genetics. It will be different next year.
Right.
There will be 47.
Right.
So there's at least 45, and that is because they have spread so widely, but they're starting, there's geographic barriers, there's man-made barriers to their interbreeding, and so they have started to have their own different subspecies. One of those is, there are a variety of actually threatened or endangered subspecies, more out in the West Coast, etc. But yeah, 45 different, which is cool. So the red foxes in the US or America there were definitely native red foxes here. There likely at some point in our history have been some introduced species from Europe is suspect. And so you could spend days looking into genetics of red foxes. And there's arguments, as all geneticists do when they find their information. But likely there's some hybridization from the European red fox into ours in different areas in the US, but they are a native species here. They are not invasive here. They originally were in old growth forests, but since they have been so adaptable, kind of as humans continue to expand, cut down forests, they moved with us across all these continents.
Okay.
And so because they are so adaptable to different habitats, they can be in forests, but also grasslands, urban environments, some of those kind of transitional areas between those, they really have been found everywhere.
Mm-hmm. So habitat requirements, which you're touching on now, that they're very adaptable, but are there a few requirements that they need to say, like, I need an underground den, I need a hollowed out log, I need a water that comes in a stream, or not?
Yeah, closer to the not. There are, the extreme southern areas of the country into Mexico. They don't go that far. Some of the heat, but they're in urban environments. They start to go up into mountainous terrain. They're encroaching with the Arctic foxes up north, so they really can take over many habitats. When kind of in an urban environment, when we were tracking them, compared to coyotes, they were using more of like backyards and smaller parks in an urban environment. And so having, some cover that's not strictly human containing probably is a requirement, but they'll den under people's patios and porches and garages. So they really have come alongside us in kind of their adaptation, but they'll also be found in farmland, in forests, wherever. We talk about dens, so a little bit about a fox den. So foxes use dens mostly for just raising their kits.
Okay.
So the rest of the year, so that's kind of winter into early spring, the rest of the year, they don't typically use a den. They'll often just sleep outside. But the den is a great way to contain the young, protect them. And so that's kind of the use of them. They will take over former burrows of other animals and usually dig them out further. So, we can get into conflict with foxes later, but if you want a fox to not burrow under your porch, garage, etc., making sure that you're taking care of any of those former dens, burrows, don't allow them a good place to move in before they breed in the winter. Once you have them, they're yours until they move
out. I've certainly gotten calls from people who have had dens like underneath their shed or something like that. Most people, at least in the urban environment, and the calls that I get, are actually happy to have them there, and they're more concerned if they see a kit limping or something like that, then they are, concerned that, no, we got to get rid of them, which is great. It's very different than skunk.
Well, again, they're very cute.
They're very cute. They're very cute.
Goes a long way.
Really are.
Well, since you bring up kids, so we can go into a little bit about their reproduction and such. So foxes tend to breed in the winter, so depending on what area you're in, that can be January, February, or a little later if you're more northerly. And so A misconception about foxes is that they are monogamous. So I've seen that repeated everywhere.
I just learned that's not true.
Socially, they can be considered ish socially monogamous. So usually when they'll find a pair and that pair will raise kits together, but that pair may not be completely the parents of those offspring. So typically there will be, depending on the number of animals in the area, the population density, a female may breed with multiple males. And there was a paper I read, I think it was out of Britain. So again, different in different areas, but they are widespread across the world. But they found, I think, 1/3 to 2/3 of litters had mixed paternity in them. So it's a pretty significant number, can be. Males will have a larger territory, females have smaller, so there may be a male over a territory with multiple females and their kits. But typically a pair of a male and a female will work together to raise that litter to bring food for them until they are grown and dispersed, and then foxes return to being solitary animals. So most of the year when they are not involved in raising kits, they hunt alone, they're living alone, and then they pair up to breed and reproduce in the winter and spring.
Boy, that is one way to really sort of ensure that your genetics are passed along. I like it. I like it. And being that the socially monogamous, so the pair will take care of the kits until they're out. It makes sense as well, because you don't know if, how much of your progeny in this relationship is yours. So we're gonna hedge the bet. We're gonna take care of these kits. That's interesting.
And it somewhat depends again on density. So in areas that have more red fox density, you may have, different social structure, or in different urban areas versus rural areas. But it appears they have some flexibility in that relationship based on their needs for both reproduction, getting their genetics passed on, but then also to raise those kits.
Wow. So they're breeding in the wintertime all over the place. And then they're denning. How long does the kit stay with the adults?
Yes. So the kits are born, again, depending on where you're at, March or April. They gestate for almost 2 months. They're born in that den, and they stay in that den for just over a month. So about 5 weeks-ish, and that's when they'll be nursing. Mom will mostly be doing their care. They'll both hunt to feed themselves, but they're nursing at that time. They wean at about 10 weeks. And then, so from that 5 to 10 weeks, the kits start wandering around near the den, but they're still nursing off of mom. And then at about 10 weeks, they're weaned. So we're talking, summertime, they start to learn how to hunt with that family group. And so mom and kits will stay together until around the fall. And so going from fall into winter, those kits start to disperse. So males tend to disperse more or further than females. Both are capable of movement pretty far, but the males tend to have a larger home territory. So it takes them some time to find that territory. And so they're dispersing kind of in that fall to winter time, and then they are sexually mature come that next year. And so if they find a place to breed, a breeding pair, then they may start breeding come that next year.
I'm wondering, going back to kits when they're born, do they kind of follow a similar pattern that like other canids or dogs would, as far as like they can't hear or see when they're born, and then they open up their eyes at a certain amount of time and start to hear and things like that? So could you kind of go through a little bit of that development?
Sure. I can tell you what I know. So I have not. Since they are in that den for 5 weeks, usually you're ideally not seeing them until they're more mature. But they do go through the same sort of development like other canid species. So yes, their eyes are closed. I think it's for about 9 days until they open, and then they're nursing till they're about that 10 weeks. So they're going to go through stages of development similar to our other canids. So if you're seeing a kit that young and they are not with mom, they need help.
Okay. And that just helps. There's some like I was talking to somebody about skunks recently, and they were saying, if you see a skunk kit out by itself, it needs help. It's not like you can with some other species where you might be able to put it in a box with a wormy thing or whatever and hope the adults can come by in a certain period of time. It's not like that at all. It's like they need help. So similar there, if this kit is found outside the den kind of by himself, needs help.
Yeah, it's probably not good. So some things, just since we're on the subject, that I have seen that could potentially be a cause for a kit to be out or a potential to reunite a kit. Some fox mothers will move their kits between dens. Either there's some problem with the den, some of our wet springs, sometimes dens will flood. And so, or there's, too much human interaction, predators, something, and she decides she needs to move them. That could be a time that if she's interrupted, potentially there might be a kit alone between where she's moving them, or there may be a litter that seems abandoned or something like that. So there's a lot of kind of those associated questions to ask if it sounds like it could be something like that, if the kits look like they are hydrated and healthy, and maybe a finder says, oh, there was an adult, but she ran away or something like that. Potentially, if you can find that den, there could be the chance that it could be reunited.
Right.
If you really know that area and that family. But that's one of the only times I've had that reunite sort of work, and the only times I've seen them that young. Was out moving them.
Okay.
Otherwise, if they are, dehydrated, thin, poor body condition, found alone, wandering around at this young age, probably they are an orphan or they need help.
Okay. And that makes sense, right? Just kind of fits right in, just a slightly different natural history. So then they're on their own, they're breeding that next year. How long do wild fox live? Do we know?
Yeah, ish. So it depends on the environment, obviously. Estimates are about 3 years. So not that long.
Not long.
No, and certainly that varies based on the environment, where you are in the country, etc. So one of the downsides of being, say, an urban fox is there is a very high degree of mortality from being hit by a car.
Yeah.
Especially come the fall, when these juveniles who still don't really know entirely what they're doing are moving a lot because they're trying to find a territory. They have to move out of their environment to a new place that's going to transect a lot of roads, and that's where a lot of them end up being hit by cars. So again, this is all going to depend on city, etc., and there's not that many reports, but the ones I've seen, mortality from being hit by a car can be even up to like 40%.
Wow. Yeah, that is pretty high. How many kits do they have?
Depends on the litter, but anywhere from like 4 to 10. I think in the like 5-ish is fairly average.
Okay.
A lot of that I think is based on nutrition.
Oh, sure. Makes sense for the adults. Yeah. Especially the female. Yeah. Huh. Yeah. That is surprising that they don't live very long. I mean, I'm now used to like thinking about opossums that way, but not an animal like a fox. And I suppose it's because I'm relating it in the back of my head to dogs or other things, right? And they can live a fair amount longer. But of course,
in captivity, they can, if you take away the pressures of living in that environment. Foxes in captivity can live 15 years. something
So
like
they can.
that.
So that is interesting because with opossums, they still don't live that long
No,
in captivity, no matter
no,
what you do.
no.
They still don't live very long. So that's interesting that it really is directly associated with the pressures, especially in an urban environment. I would imagine that in a rural environment there are similar pressures, but maybe different pressures, whether it's
Yeah, I think it's a different balance of pressure.
yeah,
So you think about sources of food, which actually in an urban environment, we can talk about the quality of the food they find, but it can be higher.
right.
They can live in much greater density because there is more access to resources. But that density, those resources being by roads, you have a lot
Mhm.
of vehicular mortality, a lot of potential for transmission of disease based on population density, which is going to be an issue in rural areas too, but potentially if they're more dispersed,
Right.
less of an issue. You talk about rural areas, finding, appropriate food sources may be more of a pressure there because
Hmm.
they don't have the city resources. So yeah, I think they're similar pressures. It's just a different balance of them.
Right. Right. Okay.
Also
Um,
predators.
oh
Can we
yeah,
talk about
other
predators?
predators. Oh, let's talk about predators of fox. Yeah.
Yeah. So I mean, predators of fox are going to be larger carnivores. And I say predator in that they are a cause of mortality of foxes. They're not necessarily feeding off of them. So
Okay.
there can be conflict between, say, coyotes and foxes. A lot of it is more over territory versus a coyote killing a fox to eat.
Hmm.
More historically, you'd have predation from larger carnivores such as foxes. Some of the larger felids may prey on foxes, but a lot of said predators are not as populous as they once were. And
Hmm.
so we have somewhat removed that top level control of our red foxes.
Hmm.
And so less kind of pressure from predation, leading to potentially higher population densities, higher spread, but then they're finding more pressures in other ways, such as
Right.
disease, being hit by cars,
Right.
etc. And then
Right.
humans are certainly a predator through hunting seasons
Oh, that's true. That's true. Because for like
and
fur
fox
hunting,
trapping.
right?
Yep,
Yeah, it's
yep.
for trapping for fur. Okay. So wow, I'm learning so much. And I thought I knew a lot. This is amazing. That's what I love doing this podcast. I've learned so much. Um, if I can retain it, that's the thing. I'm gonna have to go back and listen to the ones we recorded on different things. There was something else I was gonna ask. Maybe what we'll do, it'll probably come up as we're talking about like why they come into care and illnesses and injuries. And so some of my other natural history questions I think will probably come up. Oh, I got one. I got one. What do they eat?
I was just gonna say, there's one that I
We
have.
haven't talked about that. What do they eat?
They are solid opportunist. So
Mm,
they will eat most things they will come across, but what is higher in their diet is going to be rodents, rabbits. They'll eat birds, they'll eat eggs, they find
mhm,
snakes, insects, berries, whatever they find in an urban environment.
mhm,
So really whatever they can come across. They do, I know from experience tracking them, chase feral cats. So potentially that may be a source of prey in the city.
mhm. Yeah, that makes sense. I know coyotes certainly take advantage of feral cats in a community. Another vote for keeping your cats inside,
Yes.
which most
Elevate
rehabilitators are fully
the
behind.
medical care of cats and keep them inside and take them to your vet.
That's right.
It's
That's
about
right.
animal welfare, and the cats are involved in that welfare.
They are. I know. And I have three cats. We were just, you have a few cats too, and love my cats, but they're indoors
Yes. They
unless
have
they're on a
a
leash outside.
exceptional catio, and
You do have an
that
exceptional catio.
that makes my cats happy and keeps the wildlife mostly safe.
Yes. And our cats currently go out on a leash, but I have plans now for a catio. So anyway, okay. We're going down a different rabbit hole.
We
Oh,
digress.
how did that happen? Well, because it's me. All right. So, we're mostly going to be focusing on urban foxes because I think where at least the rehabilitation, well, maybe not. Maybe not. I'm not going to make any assumptions. Why do fox come into care?
Yes. Um, I mean, yes, we will not make assumptions, but I do feel like in order to treat the fox, someone has to catch the fox. Therefore, we have a higher percentage of urban foxes in our care.
Yeah.
Um, and as we all know, as rehabbers, one of the largest causes of any wildlife admission is human interaction. So this all makes sense.
Right.
But probably the most common causes of foxes coming into wildlife care is one, orphans. So if something happens to mom or they are separated, just like all of our other baby animals, we can have orphaned foxes. For those foxes especially in the late summer, fall, as they're starting to disperse, juvenile and subadult foxes are very commonly get mange that first year. So that sarcoptic mange can be quite prevalent in that group. Adults also get it as well, but certainly those subadult foxes are seemingly more at risk. Nutritional issues, so emaciation, especially secondary to, again, being in that first fall and winter, are dumb juvies.
No, they're still trying to figure out what they're supposed to be doing. They can't go home.
It's a lot of pressure. It's hard to adults. So that verse secondary to some other injury, illness, they get wounds, they get hit by cars. So if they survive that, we're talking head trauma or fractures or other wounds. And then a topic that I'm sure is still up there in all of our rehabbers' minds is foxes are able to get highly pathogenic avian influenza. And so for the last few years, that has been an issue. Other infectious diseases more commonly known in our canids are distemper, parvovirus, or rabies. They are susceptible to all of those. So those are probably the top list I'd give.
The top list. Oh my gosh, it's a nice, extensive one. Okay.
Mange and injuries.
Mange and injuries. Yeah.
Would be
and we're going to try to go in depth in at least a couple of these for people kind of wanting to know how you manage and how you treat some of these challenges. So, okay. So those are illnesses and injuries. We're not going to talk about orphan care today because we wanted to talk about the medical management and rehabilitation. And so that's going to be mostly the subadult, juvenile, kind of just on their own, subadult and adults. Let's focus on the diseases for just a couple seconds. It'll be more than a couple seconds, and then talk about like what it looks like when we'll pick a case and what it looks like when it comes in to care, how you handle them, how all of those kinds of little details. So let's talk about mange. What is mange?
Sure. So mange is an infection by the sarcoptic mange mite, or Sarcoptes sarcoptii. It's a little mite that burrows into the skin, and so kind of goes into that skin layer, and it feeds on things in the skin. It produces a lot of irritants. The body reacts to it, produces a lot of crusting and redness, secondary skin infections. And so there's a lot of localized things to the actual skin itself. Can cause a lot of itching and then kind of other irritation. But what happens is, due to that intense itching, the associated infection of the skin, it can actually lead to reduced ability to hunt. So they start to have associated malnutrition that can progress to emaciation. That skin crusting and infection often leads to hair loss. And then we're talking, especially in that kind of fall winter time, as these animals are dispersing, hair loss going into winter is really not a good thing if you live in the cold climate. So they can get a lot of exposure, so hypothermia, they're unable to maintain their body temperature. So a lot of kind of these associated other conditions are my main concern with mange. So the mange is kind of the skin infection that starts the whole process, but it can lead to generalized decompensation of this animal. They found that, I mean, this makes complete sense, but with their malnutrition, that affects the health of their GI tract. So they can get reduced ability to even absorb those nutrients. They can get ulcers. They can get parasites that continue to take any nutrients they're getting. And so kind of the disease progression in these animals is usually after infection, they progress to death usually within 1 to 3 months, depending on how severe the case they can get. They can recover. It is possible that they clear this infection on their own. There's been a lot of research as to how, and I have not found a lot of good answers. So whether it's a better immune system, better health, when they're in that state, they can kind of fight off a few infections and then recover by the time it's spring. And then they have less of the temperature sort of pressure to deal with versus the potentially more immunocompromised, younger, weaker animals may be hit harder. So there is research as to why some die and some don't. It does seem like they are able to mount an immune response, but not a adaptive immune response. So basically, once they have it, they can try to fight it based on their cellular responses. But if they survive and then get mange again, they don't seem to have either a predisposition for it or a better way to fight it off.
And it's mostly pass through contact, isn't it?
Yeah.
Other foxes.
Yep. Contact. It can be like indirect contact, so like through dens or other places they congregate. If kind of the mite and those crusts get in those places, that can transmit it to them.
And have you ever had mange?
Yeah, I have.
I have too. And
it is technically a zoonotic disease. It is scabies. It is, mites tend to like their host species, but this one, like, it is a zoonotic, it is the same mite. There's potential there might be some subspecies that are more likely to attack different species. So usually if you get mange from a fox, it will go away on its own after a week of discomfort.
Discomfort, man. I full disclosure, man, I know why fox scratch their skin off. I couldn't believe how much it itched.
Let this be a wonderful time to discuss
talk about
we should wear PPE, personal protective equipment, with our foxes and with all of our wildlife species. That can be a talk on its own. All of the potential things we can get from the wildlife we contact. I will not go into that today, but let mange be a reason that you wear PPE.
It was, and I know where I got it. I got it after and I'm starting to scratch already, reminiscing how much I itched. I wore lots of PPE, but when I went to go clean out the kennel, the cage that the fox had been in, and I was wearing PPE, but I wasn't being nearly as diligent. And looking back, I know that's where I got it. I'm like,
a great illustration of that indirect transmission.
Exactly. So just everybody pay attention. You do not want this. It's maybe temporary, but or any zoonotic disease. You really don't.
A full apron, gown, having the glove cuffs go over that, taping it.
That's what I didn't do. And I know that's what I didn't do.
And I will just think about how you restrain a fox potentially close to your body for any treatments, and you'll think about where you might get it.
That's right. You can get that visual just listening.
I'll leave it at that.
We'll leave it at that. All right. So Thank you for that aside. I never want mange again. I've been in this business for over 30 years, and that was the very first time that I ever knowingly accidentally got a zoonotic challenge.
And let it be like you can get meds for this. So
Yes, and I
this
did, and I
stage,
thank
you can
God.
go to the doctor. You will have fun explaining it to them, and you may have trouble getting them to believe you, but yes, you can get meds for this.
Yeah.
It is from a
They looked it
fox.
up on actually they believed me,
Okay,
and
good.
they double checked on the CDC website, which was for making sure that they got the treatment right and all that kind of stuff. I'm like, wow, I was uber impressed. So yeah, I
Another
went in.
aside, be know your zoonotic diseases and be your own advocate if you ever have any health concerns, because this is not commonly taught in many med schools. It is more common in vet schools. Um, but yes, I have gone to several doctors with a card being like, these are just so you know, I have been exposed to these things.
And that's actually a very important aside, because it used to, before the internet, when we were teaching beginners, how to take care of animals and stuff, the one thing we did talk about a lot is zoonotic diseases, and we would give them a handout, a huge handout on the different diseases. And what we would say is, you don't need to memorize these. You need to bring this to your doctor and have it in your
Exactly.
file. And
Yeah,
now, of course, it's a lot easier but you do need to communicate with your doctor. Look, I work directly with wildlife. And if you come prepared with, these are some of the diseases I might have, here's some places that you can look up information. You are your own advocate, and it will help you a lot. Um,
exactly.
get to the answer quicker, right?
Yes.
Right.
Yes.
And that's what we want. Okay. So great aside. I'm glad we got that in there.
So mange
Uh,
foxes.
mange foxes. So most of what rehabilitators deal with are human interactions with wildlife, intentional or unintentional, hit by car, hit a window of your bird. I mean, those types of things, getting tracked, caught by cat, blah, blah, blah. But mange is natural, isn't it?
So it is a global epizootic. I think that's the term. It
Mm-hmm.
it is a global infection in various wildlife species, and yes, it is goes through cycles in the populations. Yes, it is here to stay, but there is quite a bit of evidence that it originally came from people. So it is not something that they have necessarily evolved with over time, their own natural
Mm-hmm.
defenses. It is not in red foxes. It's a significant pressure, but most red fox populations are stable. So they
Sure.
are able to compensate through reproduction through their natural history, but I would not consider it a, you know, natural, healthy, native disease. Like it
That
has
they,
been
mm-hmm.
introduced to different
Okay.
species and it can cause widespread die-offs.
And I mean, it's just very good to know, because a lot of people will say, well, let nature take its course. It's like, well, maybe not. I have also read a few things, but of course, right now I can't pinpoint the exact article, so I may have to go do some research before, so people have it in the show notes. But that there might be some evidence with climate change that it's causing a lot of changes with mange, increasing it, and longer time infection or whatever. But that's also a challenge that they're having to deal with and will be dealing with more.
Yeah, I would agree. I have read that, but I don't have the source. So
Yeah.
we should fact check this for sure.
We will fact check
Um,
it.
However, more generally speaking, many of our parasitic type diseases definitely are affected by climate change. It changes kind of the life
Right.
stages of those parasites. It can speed up infection. It can change kind of the pathogenicity. So it's definitely, I would say, the effect of climate change on different disease progression will be something that we will probably see as rehabbers in our lifetime,
Exactly. Yeah. And we're
unfortunately.
definitely already seeing, not just with fox, but with other animals, and
Correct.
more frequent, starvation events or whatever it is. It's already increasing. It's evident. But yeah, I thought I'd just pause there, because a lot of people are like, let nature take its course, and aren't those diseases natural? Yeah, kinda. but they came from us. How lovely. Okay. So we're talking about mange. There's another little thing about mange that I do want to bring up because I've heard about it. I've not investigated it much, but we were talking before and you definitely, especially being a veterinarian, have some thoughts about mange by male.
Yes, I will contain some of my thoughts. No. So mange by male, there are a variety of sort of attempts to help mange infected animals. Mange by male is one of them. There are other organizations doing this sort of thing. But the basic premise is that mange is caused by a parasitic mite. These mites can be killed by different medications that we use in our domestic animals, usually ivermectins and other drug classes like that are you can purchase at a farm supply or other stores. You may use these products on your dogs and cats for parasite prevention. And so where these groups are coming from that I appreciate is, how do we help this animal try to clear this very, very uncomfortable to life-threatening sort of disease without putting them through the stress of trapping and treatment and rehabilitation, etc.? Why don't we just medicate them in the wild? Okay, I can see where they're coming from, but there are some issues with this. So I'll start with the patient-centered issues with this. So I implied some of this talking about how mange affects the body, but mange is not just a skin disease, just in heavy quotes, because it's a very severe skin disease, but it's not just what you're seeing on the surface. And so there are so many other systemic level impacts of this disease on these animals that are not treated simply by killing off that mite.
Right.
And so I would be concerned that in treating these animals, you may take care of the mite infection or knock it down some. However, you're not dealing with the associated other illnesses and providing the supportive care these animals really need. So are they surviving? Not sure. Secondary, a lot of these medications, like the ivermectins, do kill off other parasites. A lot of these foxes end up having really severe cases of internal parasites. And if you kill off all of those parasites all at once, you can cause a lot of other GI issues.
Also including death, right?
Including
if they
death.
have a really high parasite load, internal parasite load, they all die. It's a shock to the body.
It's a shock to the body. Those internal worms, they can all create like a clump basically of dead worms and be a blockage in the GI tract that's already not working well. I know, great image, but it's true. Some parasites latch on more to the intestinal lining, and so them all coming off can actually cause bleeding into the GI tract. And so I think we talk about deworming as such a routine basic thing, but in these severe infections, oftentimes I'll try to stage that process with a lot of supportive care so that I'm slowly killing off that parasite burden while making sure I don't put that body into any sort of shock from it.
Right. And if you're doing mange by male, there's no way to know.
Exactly.
You have no idea
control over any of that. And so kind of, best case scenario is a mild case comes into a rehabber. They can give it the appropriate treatment. They can monitor it for any secondary conditions. It can, heal quickly. It can not have any issues, and it can go back into the wild. And that's good. I'm okay with that. I'm okay with the mild case coming in. What the worst case is that severe case dying in the wilds when it could have gotten care. And so I am unwilling to put the pressure of judging which case is which on someone without any medical training or diagnostics, because sometimes you can't tell externally. And so I do not think it is appropriate care for the patient, which is top in my mind. Second in my mind is the actual legality and sort of logistics of these things, where it's not legal to be giving medications to wildlife species out in the wild. So you're
for
feeding a
lots of
chemical
reasons.
to a wild
Yeah.
animal that you're not permitted to contact, handle, touch, any of those things. A lot of these animals are considered technically food species. They are hunted, and so putting any sort of drugs into the environment without any control over potential harvest of that animal is not appropriate.
Mm-hmm.
The diagnosis of a condition and treatment of condition is considered practicing veterinary medicine. And so technically by law, I would consider this practicing veterinary medicine without a license, which is not appropriate and illegal and has fines.
For a good reason. I
For
mean,
a good reason.
how
It's
many
unethical.
years have you been studying and learning the practices of veterinary medicine? It's like, oh, I'll just do mange by mail.
And then, you're not catching the animal, so deciding an appropriate dose. Perhaps in a healthy animal, some of these drugs have pretty high dose safety ranges. In a animal who is decompensating and emaciated and maybe looks fluffy but is half that weight, that could be potentially an issue. So there's just a lot of logistics over the actual doing this well, and then doing this well is still, in my opinion, unethical and it is illegal. So
right. And the devil's in the details.
This.
Yeah. Say that again.
I do not recommend any treatment.
Recommend it.
In the
labs. It just seems like it seems simple on the surface, right? Like we were talking about, because it's just mange on the surface, but it isn't. It isn't. And there's so many other factors. And I'm glad you brought up that they're technically considered a food animal, because, I'm sure some people probably do maybe consume them even if they're catching them for their fur or something. But I was also thinking, boy, you put a bait out that it's for the fox, but how are you 100% sure that fox is going to consume 100% of that something else might not come and ingest a medication that they don't need and might do harm, and they may also be a food animal technically, right?
Correct.
So I mean, all of those things.
There's the non-target ingestion, which is a concern. There's the concern of having the public bait a wild animal in general, because you're then teaching this animal to eat food put out by you. So that's not something we want to have any of these animals learn for future conflict. Along with that conflict is bringing a potentially sick animal into an area that is where humans frequent or other pets frequent, because there's potential for disease transmission there. And then for any drugs, especially drugs that are targeting pathogens, so parasites, bacteria, etc., there is concern for creating resistance. And any sort of incomplete treatment protocol is concerning to me, that it may create potentially resistant pathogens. So
and make it worse and worse in the future, and the drugs like ivermectin less and less effective in the future. Ugh, yeah. Superbugs. Yay. It's not a superhero movie. It is not.
Supervillain, perhaps.
Supervillain movie. Okay. Thank you for that. Much appreciate a lot of the detail, because that helps when rehabilitators are talking to the general public and someone says, well, I'll just do something like mange by mail or something. And then this gives them a lot of great talking points for why that is really not the solution to the problem.
And like anything, you bring it back to what people value. And I don't blame any member of the public or people doing these programs. They're very well intentioned. However, knowing the disease progression in mange, knowing how severe it can get, and then knowing some of those details, it's not appropriate or ethical to do so. Right. So I see the intent, and I would like to redirect that passion for helping animals into a more appropriate solution.
Exactly. Totally agree. But thank you very much for all of that. That was the first of my two-part discussion with Dr. Miranda Torkelson about caring for red fox. In part 2, episode 11, we continue talking about the medical management of red fox with topics that include trapping, more on treating mange, itch and pain control, housing, and more. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buhl. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit raptor.umn.edu. Our producer is Kirk Klocke. Special thanks to our guest, Dr. Miranda Torkelson, Partners for Wildlife, and the Raptor Center at the University of Minnesota College of Veterinary Medicine. And that's our show. Hope you'll join us again next time.